Hello everyone, Megan Ray here with Insurance Marketing Enterprises and our weekly video. You can also find us online through our website or with Facebook and Twitter. Today's video is going to be about a timeline for healthcare reform, or Obamacare as everyone has been calling it. I'm going to cover quite a bit of information, so I'm going to try and keep it at about 6 minutes, which is longer than our usual video, but it's important information. Today I will be presenting quite a bit of information, but it's all listed below so that you can see it in print. I'm also going to be using notes so that I don't miss anything or give you incorrect information. So let's jump right in. Just briefly, in 2010, some of the highlights. Healthcare reform eliminated lifetime maximums and annual maximums. It also allowed for dependents aged 26 and under to continue being on their parents' plan. High-risk pools were developed at the state level to help adults with pre-existing conditions. As an example, Colorado already had a program called Cover Colorado, but we received additional funding and started a program called Getting Us Covered to help additional adults with pre-existing conditions. Also in 2010, healthcare reform eliminated pre-existing conditions for children only, ages 19 and under. Also, tax credits for some small employer groups began in 2010. In 2011, employers were supposed to start reporting the cost of benefits to employees on their W-2 forms. However, that was delayed, and I'll touch on that in a later year. In 2011, over-the-counter meds and other medical equipment was no longer an allowed expense through people's health savings accounts. Then in 2011, minimum loss ratios, or MLR, was implemented for insurance carriers. This means that they must spend between 80 and 85 cents of every dollar they earn towards actual healthcare costs, and that applies to non-grandfathered plans. In 2012, claims review and appeals processes were required for all insurance carriers. Women's preventive health services must be covered at 100%, also for non-grandfathered plans. And then in 2012, a summary of benefits and coverage, or an SBC, and uniform glossaries are required for all plans. Now this year, in 2013, Medicare withholding tax for those making more than $200,000 increased from 1.45% to 2.35%. Flexible spending accounts were limited to $2,500. Health and Human Services, or HHS, has been evaluating each state's exchange to see if they're ready to go or not, and then letting them know about that ruling. Then this is where each employer must report healthcare costs on W-2 forms that I mentioned in 2011. Now groups that issue 250 or more W-2s each year are required to do the cost of employee benefits reporting. Employers also need to communicate with employees about benefits and options within the exchange that's coming up. Now, beginning July 31st, so the end of this month, insured people and self-funded plans will pay $1 per member to fund comparative effectiveness research of medical treatments. That will increase to $2 per member after 2013. Then on October 1st of this year, federal and state health insurance exchanges are going to open so that people can buy policies through an exchange, and those plans will go effective January 1, 2014. Within the exchange, this is where people can use things like subsidies and advanced premium tax credits. We will have another video that talks specifically about what those are and how they function. Also in 2013, group health plans must verify with HHS that they are compliant with the law. Now moving on to 2014, this is all stuff that's coming down the pike on January 1st. State health insurance exchanges begin, as I mentioned, for individuals, and then also for small businesses with 50 employees or less. Individuals must buy health insurance or pay a penalty. It will be either $95 or 1% of annual income. There's also some other calculations for families. Employer pay or play goes into effect, so the rules on full-time equivalent employees and limited waiting periods also go into effect. Medicaid will expand. The health insurance exchange plans will begin providing coverage, as I mentioned, January 1, 2014. No pre-existing conditions for adults. That's huge. That went away for children, remember, in 2010, but now adults, it goes into effect in 2014. No annual benefit limits. Insurers must cover the cost of clinical trials, and there will be rewards or incentives for wellness, up to 30% of the cost of coverage for a single individual. Then on January 15th, employers will begin paying quarterly fees for transitional reinsurance programs. Then a little further down the road in 2016, states will be allowed to form what's called healthcare choice compacts, where plans can be offered across state lines. 2017, employers with less than 100 employees can purchase coverage through the exchange. And then in 2018, there will be a 40% tax on Cadillac plans. So that's a brief summary of the healthcare reform timeline, what's already gone into place, and what's coming up next. And I hope you'll have a better understanding of how that all works. No one expects you to navigate this all on your own, so get in touch with an agent or broker near you and have someone help you and guide you through this system. If you like the information that we've provided here, please subscribe to our channel or find us on Facebook and Twitter. That's all for now, and hopefully we'll see you next time.